Hello, I'm Sally Rickard. I'm Managing Director for the Wessex Cancer Alliance. I'm talking to you today about the World Cancer Day celebrations on the 4th of February, and with that, the release of a 10-year plan for cancer services in England. Over the next few weeks, we'll cover some podcasts talking about the different areas and ambitions set out in the 10-year health plan for cancer, and what that will mean for people living in Dorset, Hampshire and the Isle of Wight. We're going to look at how that compares to our existing cancer strategy for Wessex area, what the changes are, what the level of ambition is compared to that which we described in partnership with patients, public and our healthcare professionals over the last few years. The headlines of the cancer plan cover fast diagnosis, quick treatment and good patient experience. The plan describes improving survival from cancer such that by 2035, 75% of people or more diagnosed with a cancer will survive for 5 years or longer. That's a significant improvement from where we are now, but an ambition that we're very keen to develop and to go after. And finally, the plan focuses a lot on living well after cancer. What we hope is that people that are diagnosed with a cancer go through their treatment and then live rich and fulfilling lives beyond that diagnosis for many years to come. And what that means for each of us as an individual to live well beyond cancer is something the plan seeks to explore and that we want to work together with you to look at and understand. We need to work across a number of different organisations. This can't be something that the NHS do on its own. We have fantastic voluntary sector organisations across our geography, together with innovators, world leaders in research, and very engaged and activated patients and public. We need to work together to define how we want our cancer services to look and to translate that into action for future services. Cancer performance in the cancer plan is described as a proxy for the whole performance of the NHS. The plan positions improving cancer pathways as a way to improve the whole system. If cancer services are good and strong and delivering the performance they should be, it is likely the rest of the clinical services in hospitals, across primary care and in our communities will follow. That's an opportunity for us to put cancer at the heart of all of our healthcare services and to really recognise that as cancer is a disease that affects 1 in 2 of us in our lifetimes, it is something that rightly should be at the front of healthcare services. Inequalities are a core driver in the plan, and it repeatedly stresses poorer and underserved communities are diagnosed later and experience worse outcomes. In our own local plan, we have stressed the prioritisation that we put on working very specifically with each of the different communities across our geography and how we want to be sure that everybody feels heard and that their service is responsive to them. And finally, the plan calls for a shift, not just incremental changes, nudge by nudge, but a paradigm shift in the way that we deliver productivity, in the way we communicate with patients and across the NHS, and in a way that we embrace and use innovations and genomics fast from research bench through to frontline care. So what we hope is over the next few weeks and months and years, you will see a better cancer service that's there for you when you need it and that's able to embrace and support all of our workforce to deliver the best care for the future. In terms of workforce, there are some asks in the cancer plan, particularly around diagnostics, clinical nurse specialists and development of consultant roles. We know as the incidence and prevalence of cancer increases and the complexity of the disease continues to become aligned with that of other long-term conditions, alongside the increasing survival and potential side effects of some of the treatments, that we need a workforce ready to support an ever exponentially growing cohort of patients either under active treatment or living beyond cancer. How we prepare and support our primary and secondary care workforce to be ready for this transformation, and what we can do to make care seamless for patients no matter where they are treated, is something that we will need to work with our Ascend partners and our partners in NHS England, health education teams, but also with those on the ground working in primary care and in secondary care, the nurse leaders, the consultant leaders of our systems, to really understand what the gaps are, what training needs and support needs are required, and how we staff and support all of the services that we need to transform our care into for the future. The opportunity that having a cancer plan for England that goes 10 years and sets far-reaching, stretching ambitions is a really exciting one. It gives us the opportunity to bring cancer back into the spotlight and to really drive together the improvement of our services for our population. I look forward to discussing with you and colleagues across the geography over the next few weeks in a bit more depth the different elements brought out in terms of the plan and what that will mean for us across our health economy.